All over the United States, there are communities that don't have enough healthcare providers. These communities may face economic, cultural, or language barriers to healthcare. The National Health Service Corps ensures quality healthcare is available to millions of patients at thousands of community healthcare sites around the country, including sites like Full Circle Health in Kuna, Idaho.
Kuna is like a family-oriented community. Lots of different ethnicities, backgrounds, very diverse. Like a lot of Idaho, it's changing a lot, but there's still some areas of kind of underserved and rural populations to it.
NHSC-approved healthcare sites, like Full Circle, partner with the National Health Service Corps' loan repayment and scholarship programs to increase the number of providers in the community and decrease barriers to care.
I personally come from an underserved area, grew up in a really small town here in Idaho. Receiving the National Health Service Corps loan, being able to give back to underserved areas and being in rural communities and then getting that support has been really helpful.
Over time, the NHSC has expanded its focus to help the nation address crucial shortages, such as maternity care providers for women who would otherwise have insufficient access to pre- and postnatal care and regular preventive screenings.
The area we're in doesn't have enough maternity care providers, so patients travel to Kuna as the closest area to see a doctor.
Not only can you get all of your primary care, mental health, and pharmacy care here, but at the same time, our mission is of education as well. So it's a win-win in regards to helping educate physicians for the future, helping care for patients in the present.
NHSC providers and approved sites also play a significant role in meeting public health challenges such as the opioid crisis. Providing substance use disorder services, including medications for opioid use disorder treatment and behavioral health support, these resources are often the lifeline for patients in hard-hit rural communities and urban areas.
Full Circle Health tackles two of the toughest problems we face in our community, that of mental health challenges and drug and substance abuse. So how we construct our clinics is to have an integrated team of primary care physicians working with psychologists and social workers.
Being able to have their counselor and their medical provider under one roof is a tremendous benefit for them. And it just adds to the safety and comfort that patients feel. If a patient were to disclose that they struggled with some aspect of addictions, one of the things that we try to offer under Full Circle Health is being able to reach out to our head physician that does the addiction medicine and say, would this patient fit right in your program?
Can you take a big breath? Can you go?
Thanks to the tens of thousands of NHSC doctors, nurses, dentists, social workers, and so many others who are willing to serve in these high-need areas, essential health care is accessible to those who need it most.
I think from a very young age, I wanted to work with people. When you go into the line of social work, you don't really go into it with the money, but the debt still exists. So the fact that you're able to have these resources, it's amazing. I mean, you feel the weight off your shoulders a little bit in your day-to-day personal life.
A National Health Service Corps award is the beginning of what may be for some a short-term commitment, but most often turns into a lifetime of fulfillment and service.
I recently finished the National Health Service Corps Students to Service program. When I first started out here, I thought as soon as I was done with my service, I may just want to leave, but I actually stayed longer than that service requirement because I fell in love with the clinic and with the people here.